It starts subtly. It's a tightness in your heel, a discomfort you kind of push aside. But for many, plantar fasciitis very quickly becomes a daily obstacle. It makes even simple movements become a challenge. Traditional treatments offer some relief, but a new wave of regenerative medicine is rewriting what's possible. They use the body's own biological tools to heal from within. I'm joined now by Dr. James M. Losito, a leading expert in regenerative therapies, and Patrick Penny, President and CEO of EmCyte Corporation. We're going to explore how this approach is changing how we treat pain of the feet. Talk to me about fasciitis.
Yeah, it can be at the heel. It's probably the most common presentation of plantar fasciitis, and it's one of the top 5 podiatric problems.
Is there any way a patient can do a self-check to sort of confirm that it's the plantar? Talk about what the plantar fascia is too. So.
Yeah, I mean the plantar fascia is a structure, ligamentous type of structure on the plantar bottom surface of your foot that connects your heel with the ball of your foot. And the pain can be in the arch along the course of the fascia, but most frequently it's at the heel where it attaches and inflammation occurs, and in some cases a bone spur actually develops.
Very common. And how do you develop your therapies in case people missed some of our last conversations together?
Well, our therapies surround utilizing patients' growth factors and stem cells. And the technology behind what we do is the ability to concentrate them at levels that are much higher than what the body would normally see at that injury site.
And using plantar fasciitis as our sort of point of entry to this conversation, that's primarily an inflammatory condition.
Predominantly, there's inflammation as well as micro tearing of the fascia. Typical management would involve stretching the Achilles tendon because it attaches to the fascia, and a tight Achilles tendon is oftentimes the cause of it, as well as wearing some kind of orthotic insole, and then some kind of medication. And frequently, this will be a cortisone injection, which has potential side effects, such as thinning of the fat and actually weakening the tissue.
Right.
So an intervention like the EmCyte platelet-rich plasma and the growth factors that are secreted by the platelets, and these growth factors being chemicals that basically facilitate and encourage the healing process.
Well, then who wants to decrease the inflammation if you're going to weaken the structure? So you're just setting yourself up for more trouble. That's why I worry about steroid injections. But Dr. Losito mentions PRP. Is it stem cells or PRP, or how do you decide which?
So many times we start out with the PRP therapy, which really concentrates growth factors along with a lot of other cytokine mediators, fibrin factors, protease inhibitors. But when we're looking at stem cells, stem cells come from a different source. So those come from bone marrow tissue, and the difference between stem cells is technically you have hematopoietic and you have mesenchymal stem cells, which are more focused towards not just regenerating, but reduplicating tissue at that injury site.
Yeah, I mean, regeneration, reconstruction, the body can heal itself with a little help, right? This is what we're talking about with bodies.
Absolutely.
What are the patients telling you?
They're telling me they're getting fantastic results that are equal or better than if they received a steroid injection. They have less pain, less swelling, improved function, and it's actually healing it.
Ultimately, really, it's heal, but also avoid surgery. Isn't that one of the goals? And we don't want to do so much surgery.
You know, one of my visions really is to offer patients non-surgical options for musculoskeletal conditions.
Yes.
And that goes from plantar fasciitis all the way up to complex pathologies in the joint. And I think that is the trend of modern medicine right now. And I personally think that regenerative medicine sort of fits that bill. You know,
every time for the audience that I talk to Patrick, I want to point out he has a long history in medicine and has been deep in the trenches and understands what, the full spectrum of what the practice of medicine and nursing is. And this is a solution that you have been inspired by. Thank you, gentlemen. If you'd like to explore more about these advanced therapies, head over to EmCyte.com. That's spelled EMCYTE, EmCyte. We have more ahead, so don't go away.